Hello, this is John Kanalopoulos from Athens, Greece, in New York City, New York. It's my pleasure to present to you our collaborator in the novel technique presented. This is a porcine gamma radiated xenograft tissue. We're seeing an image with anterior segment OCT here, and we will go to our FS200 femtosecond laser by Wavelight Alcon and design the preparation from this xenograft of a small inlay. This is the treatment plan designed on the femtosecond laser, and this is the porcine cornea applanated with the patient interface of the laser. And again, this is an ex vivo concept procedure. There has been increased interest in cornea stromal inlays recently as a continuation to the artificial inlays, for instance, for treating presbyopia and potentially treating hyperopia. So we're dissecting here the 100 micron thick inlay, and we're going to use a cadaver cornea imaged here with topography and anterior segment OCT, and perform on this cadaver cornea a femtosecond laser created pocket to insert the inlay. The novelty of our technique is that we will combine this procedure, which has been described previously with cornea allograft tissue, with corneal cross-linking in order to further enhance the refractive effect of the inlay. So this is the donor cornea placed on the artificial chamber. We saw imaging of this cornea previously, and this is the femtosecond laser treatment plan to create a intracorneal pocket at 150 micron depth, and we'll enlarge the venting channel, the chimney as we call it, of this pocket in order to use that channel as an insertion pathway for the inlay that we have created before from xenograft porcine gamma radiated tissue. So this is our FS200 femtosecond laser working its way at 150 microns depth on this human cornea in order to generate the background to be able to implant our inlay. We'll enter with a crescent blade and here a blunt cyclodialysis spatula to prepare the pocket. And here is the inlay, toothless forceps placed and centered within the cornea, imaging the inlay in perfect position. We would assume how this would be in vivo, and enhancing this procedure with riboflavin. We have introduced the concept of performing in situ cross-linking within the cornea pocket, and this is the result. We can see the dramatic cornea steepening achieved with the cornea inlay in place and cross-link. Before and after pictures. We have refractive corrections here of adding almost 7 diopters of cornea power, and again looking at difference maps of before and after. And this is the OCT imaging with the OptiView 9mm cornea pachymetry and epithelial mapping, and in the cross section we can see the positioning of this lenticle. So within this video we'd like to introduce this concept, potentially an alternative to artificial cornea inlays, and also an alternative to using allograft tissue, since this is porcine gamma radiated stroma, expected to have very little reaction from the host. Porcine tissue has been used successfully in cardiac surgery for decades now, with porcine valves being very successful in open heart and valvular replacement. So I hope you found this presentation interesting. We're of course willing to go through more work on the subject. This is John Canalopoulos signing out, and thank you very much for your attention.